A 68-year-old woman recently told her doctor she felt better than she did at 45. Her secret? 6 simple movements that take less than 10 minutes a day. But here's what shocked her doctor most. 3 of these moves are probably the opposite of what you've been told to do. And the one movement she does in bed, before even getting up, changed everything. But we'll get to that in just a moment. Because first, you need to understand why everything you've been doing might be making things worse. If you're over 50 and still doing static stretches first thing in the morning, stop. Right now. Because here's what physical therapists have recently discovered. Your joints are actually dehydrated when you wake up. After 6 to 8 hours of lying still, the synovial fluid in your joints, that's the lubrication that keeps everything moving smoothly, has essentially settled. Stretching cold, dehydrated joints is like trying to drive a car without oil. But there's a specific sequence of movements that actually rehydrates your joints in under 90 seconds. Movement number 3 on our list does this perfectly. But you need to do movement number 1 first, or you'll miss 70% of the benefit. Let me show you why. Movement number 1 happens before your feet even hit the floor. It's called the Bed Mobilizer, and it targets the one thing that determines whether you'll have a good day or struggle with stiffness. While lying on your back, make slow circles with your ankles, 10 in each direction. Then, bend one knee and slide your heel up toward your hip. Hold for 3 seconds and slide it back down. Do this 5 times per leg. This simple movement jump-starts your circulation and begins the rehydration process. Now, here's what makes this powerful and why timing matters. Your body temperature is lowest in the morning, which means your muscles are at their stiffest. But movement number 2 creates heat from the inside out. And when combined with what you just did, something remarkable happens to your pain levels. Here's how. Movement number 2 takes 60 seconds while you're waiting for your coffee to brew. Stand at your kitchen counter for balance if needed. Place your hands on the counter and make slow, controlled circles with your hips, like you're stirring a giant pot. 10 circles clockwise, then 10 counterclockwise. Then, roll your shoulders backward 10 times. This combination wakes up your core stabilizers and prepares your spine for the day. But here's where it gets interesting. There's a specific reason we do hip circles before shoulder rolls, and it has to do with something called the kinetic chain. When a Harvard study looked at people over 50 with chronic back pain, they found that 78% of them had a disconnect in this chain. Movement number 3 fixes this disconnect, but there's a catch you need to know about. Movement number 3 is called the doorway decompressor, and it addresses the hidden epidemic affecting nearly everyone over 50. Think about how many hours you spend sitting, driving, or looking at your phone. Every single one of those positions compresses your chest and rounds your shoulders forward. Over time, this creates a cascade effect that leads to neck pain, headaches, and that hunched appearance. Stand in a doorway, place your forearms on each side of the door frame at shoulder height, and gently lean forward until you feel a stretch across your chest. Hold for 30 seconds, release, and repeat 3 times. This decompresses your thoracic spine and restores the natural curve in your upper back. Now, this next movement is controversial because some doctors still tell patients to avoid it completely. But recent research from Johns Hopkins has completely reversed this recommendation. In fact, movement number 4 might be the most important one on this list, especially if you've ever been told you have bad knees. Here's why they were wrong. Movement number 4 is the supported squat, and it's the exercise physical therapists now call liquid gold for joint health. For decades, people over 50 were told to avoid squats because they're bad for your knees. But here's what the science actually shows. Controlled squats strengthen the muscles around your knees, which reduces pain and prevents injury. The problem was never the squat, it was doing them incorrectly. Hold onto a sturdy counter or the back of a chair. With feet shoulder-width apart, lower yourself down just 4 to 6 inches, like you're about to sit on a high stool. Keep your weight in your heels. Do 10 slow, controlled repetitions. That's it. This movement alone can reduce knee pain by up to 40% in just 2 weeks. But there's something even more powerful about movement number 5, and it has nothing to do with strength. It's about balance, and it could literally save your life. Because every 11 seconds, an older adult is treated in an emergency room for a fall-related injury. Here's how to prevent becoming a statistic. Movement number 5 is called the tree stand balance, and it's based on research that's both fascinating and frightening. Studies show that if you can't stand on one leg for at least 10 seconds, you have double the risk of a serious fall within the next decade. Your balance naturally declines with age, but here's the good news. It's completely reversible with practice. Stand near a wall or counter for safety. Lift one foot slightly off the ground and hold for 10 to 30 seconds. That's it. Switch legs and repeat. Do this 3 times per leg. As you improve, try it while brushing your teeth or waiting for the microwave. Now, every movement we've covered so far prepares your body for movement number 6, the one that ties everything together. Because there's one muscle group that controls 80% of your daily movements. But it's the most neglected in people over 50. When this gets weak, everything else falls apart, literally. And the best part? You can strengthen it in just 45 seconds. Movement number 6 is the glute bridge, and it targets your glutes, the powerhouse muscles that control nearly every movement you make. Weak glutes are the hidden cause of knee pain, hip pain, lower back pain, and poor posture. Why? Because when your glutes don't do their job, other muscles have to compensate. Your knees twist, your back overworks, and everything starts to hurt. Lie on your back, with knees bent and feet flat on the floor, hip width apart. Push through your heels and lift your hips toward the ceiling until your body forms a straight line from knees to shoulders. Squeeze your glutes at the top. Hold for 3 seconds. Then lower slowly. Do 12 to 15 repetitions. This movement alone activates over 200 muscles in your body. But here's what nobody tells you about these 6 movements, and why most people quit after a few weeks, never experiencing the real transformation. The secret isn't just what you do, it's when and how often you do it. These movements work through a principle called mechanotransduction. Basically, your body responds to movement signals by rebuilding stronger, more resilient tissue. But here's the catch. This process needs consistent daily signals to work. Do these 6 movements in this exact order, every single morning. The total time? 8 to 10 minutes. That's it. In week 1, you'll notice less morning stiffness. By week 2, pain starts decreasing. By week 4, you'll move better than you have in years. But there's one common mistake that can completely sabotage your results, and it has to do with something 73% of people over 50 get wrong about recovery. Here's the mistake: thinking that if these movements feel easy, they're not working. Wrong. These aren't exercises, they're movement medicine. The goal isn't to exhaust yourself. It's to send consistent signals to your body that say, keep these joints mobile, keep these muscles active, keep this person moving well. Pain is not part of the equation. If any movement causes sharp pain, reduce the range of motion or skip it for now. Mild discomfort as you're learning? That's normal and will fade quickly. But pain is your body's way of saying, not yet. Listen to it. Now, here's what happens when you actually do this consistently. Remember that 68-year-old woman from the beginning? After 6 weeks of these movements, she reported, waking up without stiffness for the first time in 15 years, playing on the floor with her grandchildren without struggle, gardening for hours without back pain, hiking trails she thought she'd never walk again. This isn't about becoming an athlete. It's about maintaining your independence. It's about doing the things you love without pain holding you back. It's about not being afraid of falls, of losing mobility, of becoming a burden. Your body at 50, 60, 70, or beyond is still capable of remarkable things. But it needs the right signals, the right movements, done consistently. These 6 movements, taking less than 10 minutes a day, can be the difference between struggling through your golden years and thriving in them. Here's your quick recap. Bed Mobilizer, ankle circles and heel slides, kitchen counter mobilization, hip circles and shoulder rolls, doorway decompressor, chest opener stretch, supported squat, controlled lowering with support, tree stand balance, single leg balance, glute bridge, hip lifts from the floor. Start tomorrow morning. Set your alarm 10 minutes earlier. Do these movements in order. And watch what happens over the next 30 days. If this video helped you, share it with someone who needs it. And remember, it's never too late to feel better.